Well, hello there. Let's try this again. Today, we're talking about the trigeminal nerve in the TMJ, the temporal mandibular joint. You have one too. In fact, you have two of them. So, we're all about the ability to feel and move our face. That's what the trigeminal nerve is all about. It has an added bonus too, which I'll touch on at the end. So it gives us the ability to move our jaw, which we use for chewing. It sends messages backwards and forwards from the face to the brain, giving us sensitivity as well as movement. So that's to our teeth, our jaw, our face, our mouth, nose, and most of our scalp. It's the part of the nervous system that actually is in charge of those functions. So face-to-brain communication, making sure that the brain knows where our mouth is, so to speak. Its primary function is the sensory. So yes, it can move, but its primary focus is the sensory. And as such, it actually has 100 times more pain receptors, more nociceptors, pain receptors, than anywhere else in our body. So if you've noticed that you can feel more with your tongue, feel more in your mouth, it's more sensitive than any other place in your body, there's a good reason for that. There's 100 times more nociceptors, particularly pain receptors, not just sensory, but pain receptors in that area of our face, our body. It's one of the reasons that trigeminal nerve issues and TMJ dysfunction as well can be so painful. Well, hello, I'm Sarah Gowans, massage therapist and craniosacral therapist at Blossoming Me. And basically, I'm not just talking about the trigeminal nerve today, but its connection to challenging emotions like anxiety and depression that you've probably met once or twice in your life before. If you've been experiencing those, it could be also that TMJ work, fixing any jaw dysfunctions that you might have, can actually positively impact your any anxiety or depression that you've been suffering and emotions like that. The trigeminal nerve is actually branched out into three branches, and it starts just in front and lateral to the mid-pons part of our brain. So back here, basically in line with our ear, but in the back of the head, and it comes forward in three different branches. So from this level up the top of our face, and that goes to just below the eyes. The second mid-branch goes from here down to the top of our jaw. So that's the maxilla level. And the mandible level comes all the way down from the top level to the bottom level of our jaw. So the bottom of our face, all the way through and forwards. So three branches of the trigeminal nerve. And as I said, its role is to send sensory information. It's got a major impact. Sorry, the sun is getting in my eyes, so probably yours too. See if I can change that. The major role in the sympathetic, the fight and flight part of the nervous system. So by impacting the trigeminal nerve, we can actually have an effect on that part of the nervous system. But more than that, it actually has fibers in those nerve branches that also connect to the parasympathetic nervous system, the one that helps us to rest and digest, rest and repair. And that's really where the crucial part comes into linking in with our emotions. That's where we can actually help to calm our body. There is a powerful connection between the trigeminal nerve and the vagus nerve, and that's important because the vagus nerve is actually a main impactor in the parasympathetic nervous system, the whole parasympathetic nervous system. It's the biggest nerve and it has the most power in that part of the nervous system. When the vagus nerve is functioning well, our stomach is not in knots, it's actually calm. Our heart rate is not palpitating, it's calm too, it's at a slow rate, and our breathing is normal. These are effects that the vagus nerve actually has. And stress as you probably noticed in your life already, can have a dramatic effect on those functions in the body, and it can actually reduce their effectiveness, and they can function more poorly, not as well, when we're stressed. That's because the vagus nerve has been affected. So the link between the trigeminal and the vagus nerve is where our power is. It can either set us up for fear, anger, anxiety, frustration, pain, etc., or it can set us up for a sense of well-being, the peace of mind. There's actually been a recent study, a 10-day long study of stimulating the trigeminal nerve, and that actually found that stimulating the trigeminal nerve over those 10 days relieved depression in the participants of the study by over 36%. That's just in 10 days, in 10 days time. So yes, working on your TMJ, the joint here, with your temporomandibular joint, with the focus on the trigeminal nerve and settling that, can have a dramatic effect on reducing your anxiety and depression, supporting your mental health if that's been a challenge for you. Thank you for joining us here at Blossoming Me for our chat on the temporomandibular joint, the TMJ. Thank you for joining us. We really appreciate your participation. So please, if you have any questions, any input, if there's something more that you'd like to know about either the TMJ or the trigeminal nerve, please ask your questions, comment below, and we'll get back to you and even possibly do a video specifically to answer those questions. Thank you for watching, whether it's live or replay. We're sending our positive thoughts to you, even though we can't be physically together. Thank you for tuning in, and we look forward to seeing you at future Facebook Live events. Namaste.